Welcome to Ask Dr. Danett, where I answer one women's wellness question from an Eastern medicine perspective. Today's question is, could acupuncture help me? Well, this is a question I get all the time. Years ago, when I first started studying Eastern medicine in the late 1990s and then entered practice in the early 2000s, people would often ask, does acupuncture work? With a lot of curiosity and often skepticism. As more people became familiar with it, that shifted to, I've heard of acupuncture. Does it really work? And now, more often, people ask me something much more personal. Could acupuncture help me? The answer is yes. Very often it can. For anyone who may not know, acupuncture is the insertion of very thin, sterile, one-time use needles into specific points on the body to help support healing and restore balance. These needles are about the width of a strand of hair, much thinner than most people imagine. Very thin. Acupuncture is one branch of the larger system of Eastern medicine. That system also includes herbal medicine, Eastern nutrition, acupressure, massage, qigong, meditation, and other supportive practices. Together, they work as part of a complete approach to health. One of the reasons acupuncture can be so powerful is because it helps support the body's natural healing intelligence. As you may have heard me say before, your body is always working to restore balance and to heal. Acupuncture helps support that process by stimulating specific points along pathways in the body called meridians or channels. These pathways help regulate the movement of energy, blood, and lymph throughout the whole body. When that flow is strong and balanced, health improves. But if it becomes blocked or stagnant, imbalance often follows. As we get older, stagnation, especially blood stagnation, becomes one of the major contributors to many chronic patterns and health concerns. Because acupuncture is so effective at helping blood move and reduce stagnation, it can be incredibly supportive for vitality, healthy aging, and long-term wellness. When someone comes in for treatment, we address the symptom, but more than that, we look at the underlying root. If that root is not addressed, the body will continue trying to express that imbalance in other ways, often through additional symptoms or new health concerns. Because we are multidimensional and dynamic, we have to look at the whole picture, not just one isolated issue. So the way it works is you come in, you complete a detailed intake actually before you come in, you answer questions that may seem related or unrelated, and then we use diagnostic tools like looking at your tongue, feeling your pulse, and deeper assessment methods to understand what is happening beneath the surface. I also offer a technique called meridian imaging where I can create a graph of your chi so you can actually see what your body's energetic patterns look like. People love leaving with that printout or having it emailed to them because it helps them understand what is happening in their body on a different level and gives them a clearer picture of their health. From there, we determine which organ systems and meridians need support first, and then we choose a handful of acupuncture points based on what your body needs most. I may also use herbal medicine, Eastern nutrition, acupressure, and other parts of Eastern medicine based on the needs of the woman. The goal is always to support the whole person, not just the symptom, because when we improve balance in one area, we often see positive changes in other areas as well. For example, a woman may come in for help with hot flashes. We may work with strengthening her kidney energy, which is often important in perimenopause and menopause. As her hot flashes improve, she may also notice that her sleep gets better. Her low back pain, if she had it, improves, and she may feel more emotionally grounded. This is because health is connected. We are not treating isolated parts. We are supporting the whole person. Since beginning my study of Eastern medicine in the late 1990s and being in private practice since 2003, I have personally experienced this and seen it happen clinically over and over again. For those who are able to get to or will be in the Brooklyn, New York area, I sometimes have openings available for acupuncture, especially for women dealing with fibroids, perimenopause and menopause, hormonal balance, healthy aging, and the symptoms that accompany those experiences. My sessions are comprehensive and personalized because I believe true healing requires taking the time to understand the whole person and not just the symptoms. And if you're not able to get to Brooklyn, I also support women through virtual consultations and inside my online studio, Radiant Reset, where I help women build vitality, longevity, and the kind of health they truly want using Eastern medicine principles. If you are ready to take a deeper look at your health and support your body in a more complete way, Eastern medicine can be amazing. Whether that is through virtual consultations or inside my online studio, Radiant Reset, there are ways to receive support no matter where you are. And for those able to get to Brooklyn, in-person acupuncture is also available when I have openings. You can use the links below to check availability for one-on-one appointments or to learn more about the online studio, where I support women with their vitality, longevity, and proactive wellness using Eastern medicine. And as always, if you have a question you would like answered in a future episode of Ask Dr. Danett, please use the link in the description below. Take excellent care, and until next time, love being a woman.